Okay, good morning, everybody. Welcome back once again. Today, on this episode, we'll be discussing about diabetes. What causes this diabetes? Or what is diabetes? What causes this diabetes? Are there preventive measures to this diabetes? Are there hopes for diabetic patients? So, today also, we'll hear from a professional in the person of Director of Nursing Services, Anambra State, Mrs. Ezani Etel. She'll be discussing more on this topic, diabetes. She'll educate us what diabetes is all about, what causes it, if there are preventive measures to this diabetes. So let's listen up.
Diabetes is an autoimmune disease. What we mean is that the immunity of the organs in the body is low. It's destroyed. It comes down. This is due to the pancreas not being able to antibodies destroying the pancreatic cells so that it does not do its work as usual. And the causes is to enable, when the bloodstream is destroyed with these antibodies, the body does not carry its work as it's supposed to be. The organs does not do its work individually and maybe collectively as it's supposed to be, bringing about the body uses fat to bring about energy instead of the normal glucose. The body now becomes thinner because it's using fat. You see the individual who is said to be suffering from diabetes getting thin and thin. It's because it's the fat that is being burned down to get energy. All the organs are disturbed. Then the patient suffers one thing or the other. That is why you see that a patient that is suffering from diabetes has the signs and symptoms. You will know that this person is having diabetes is frequency in passing urine, always being thirsty, always weak, and quickly tired, every time complaining of tiredness. The skin gets dry, the mouth gets dry, complaining of headache, and the person seems to be feeling hungry most often. There is this itchy rash. That's, as I call it, is when it's becoming more on the person's body. You see them being drowsy, always telling you they are feeling weak, they are feeling dizziness and something like that. Then when a person is very down with diabetes, if he should have any wound, the wound will not heal quick. Then some people will tend to be obese. Obesity will set in because those that want to maintain their body, the increase in the size will become abnormal because of lack of activities, normal activities of the individual organs.
Mom, you know that you are talking in terminologies now. When you talk about this pancreas,
It's an organ in the body, and its action is to digest, produce insulin that digests the sugar intake, starch intake. Because when we talk about sugar, it's not this sugar we see. What we mean by sugar is fat. What we mean by sugar is carbohydrate. Any carbohydrate is broken down to sugar when it's ingested. Even beer apple, swallow, gari,
Rice.
rice, yam, except water yam and some other types.
Okay, can I ask you what you said that when a person has diabetes, that's a diabetic patient, if that person should unfortunately incur a wound, it doesn't really go. What causes it?
Yes, because the muscles, when the diabetes is much on the individual's body, the muscle, the tone of the muscle that brings about healing is very soft, like meat that is being put in the fridge. You know, when meat gets frozen, when you bring it out to use, after defrosing, you can touch it and it will just
Yes,
break.
TFI.
To just break.
Okay.
So, some complications follow this diabetes. That's why I said earlier, if somebody should know that he or she is suffering from diabetes and will be kind enough to himself or herself, the better thing is for the person to just accept the illness. One, once you accept the illness, you'll be able to learn about it. You learn things that will happen to you, and you know, yes, it is the sugar, the diabetes, the sugar in your body is increased, and what you will feel, and you will know there's no sugar again in the body, so that you will be able to control it yourself. You will know when to take drug.
What to
You
eat?
can now know what to eat and when to eat it. Some people even eat normal diet, but stay more on drugs. Some people take less of drugs and maintain diabetic diet. So, but each way, the person will learn his or her body to know which one suits him or her and follow it. You find out that some people will tell you they are diabetic, but you won't even notice it on them. Hence, we talk about diabetes bringing about complications because it's not only being diabetic is not the issue, but when once somebody is diabetic, the fright when we're afraid of other complications that will come because of it, because every other organ in the body is affected. We do the work of which is not doing before, and that will bring, if it affect the liver can come down. When the liver is sick and gets healed, tendency of the person suffering from liver cirrhosis, that is a part of the liver becoming very strong and cannot carry out its action, we set in. The spleen can become affected. You now start thinking about what do you call it? This illness that makes somebody to swell up, kidney disease. So these are what we are afraid of. That's why hypertension comes in. Other organs gets problem gradually till they become killer disease. Somebody can get wound and will not even know because of sensation is reduced at the extremities, the fingers and the legs. As the blood goes there, it starts to die. The skin starts to die because the blood is no more able to reach to the extremities, bringing about one becoming, for example, you hit your leg on a stone, it cuts. You won't even know because you won't feel the pain. And from there, it will continue to die and come up. Before you know it, the leg has reached, the gangrene has reached an extent. You will be advised to go for amputation to cut part of your leg. Some people will say no, they don't want, they cannot carry half leg and die. These are the things that brings about death quickly in diabetic patients. So in the treatment, most times they use drugs, a lot of drugs, And a lot of people have started bringing about new drugs. Some even create some leaves. They say when you take it, you will, the diabetes will stop. Uh-huh. So they said the people call diabetes oya ndị nnukwu mmadụ, big man disease, because of the type of diet you are recommended for, because of the cost of the drugs that is being taken. You find that some people cannot afford the cost of these drugs. Hence, some will resort to some leaves. They said some take abụba aṅara, abụba onugbu with utazi every morning. Some will say they do this or do that. These are anything that they take that is good on their body, but it's not advisable. One is supposed to go for regimen, to be on a regimen as to get that treatment completed. So I hope that people will understand that diabetes is not a killer disease, except when one is neglected or when one neglects him or herself to take care. Some people can suffer diabetes even for 30 years. I've seen some that suffer diabetes even for 30 years. And they still, that is a longer distance.
Okay, now I'm talking about these causes. Is there anything that causes it, or is it that it is hereditary?
We used to know that diabetes is hereditary. But in this present world, I don't know the disease that still remains inherited, because when you now talk about hereditary, those in that lineage know that they can become diabetic in future. Some will even start taking care of themselves that they will not become diabetic. But most of the times, diabetes diabetes sets in due to types of drug the person takes, due to the type of food the person takes, due to lack of exercise, due to types of lifestyle. Somebody's lifestyle can cause diabetes. What I mean by lifestyle is overfeeding, and feeding on the types of food that is not necessary in the body, junks. I have seen a boy who is obese from birth. The person that is obese from birth is not a diabetic person, but not controlling what he eats will now bring about every other illness, not even diabetes only. Because I came in contact with such a boy. I was advising him when he was younger. He said that he cannot even heed to this advice of less food. Therefore, when he goes into the hotel, he eats 5 plates of food. 5 plates. One boy, a boy of less than 20 years. Then when this person comes down with diabetes, there will be no remedy because he cannot control himself. Thank you.
So we've had it all. You know that what kills people mostly is self-denial. You know that you have this disease. It has been tested and confirmed. You still say I reject it. I rebuke it. It's not my portion. Well, deep down you know that you have it and it's killing you. Why not accept it and look towards the brighter side? How you can help yourself live longer. I've seen people with diabetes, with HIV, with AIDS living healthy lives. You don't even know. So my advice goes to everybody that is listening to me that if you have any sickness, any illness that you know it's terminal, but you know that there are ways in which you can help yourself elongate your life. Please, please help yourself and heed to all the medical advice and help necessarily given to you. Thank you.